All right, so this is the medical emergencies part 3. So my first one is angina pectoris. What are the 3 layers of the pericardium? And that's epicardium, myocardium, and endocardium. What blood vessels supply blood and oxygen to the muscles of the myocardium? That's the left and right arteries, coronoid arteries. And then what is atherosclerosis? That is when the fat builds up on the walls of the arteries. How does atherosclerosis cause an angina pectoris attack? So the fat builds up and it blocks the blood flow. Name 3 things that can stimulate angina pectoris attack, and that's exercise, sex, and also stress. Yes, okay. And then when a patient experiences pain from an angina pectoris attack, where's the pain normally felt? That's in the chest, neck, could radiate to the jaw and arm as well. How long does most angina attacks last? And that's 3 to 5 minutes. What happens to blood pressure and pulse during an angina pectoris attack? And that it's elevated. And then what 4 things should you send your classmate for during a medical emergency? And that is the AED, oxygen, emergency kit, and emergency clipboard. What position should you place your patient who is having an angina attack? And that's upright. And then most angina pectoris attacks are relieved by what 2 things? Relieved, sorry. And that's rest and nitroglycerin. How often should we take pulse, blood pressure, and respiration? Every 5 minutes. What is the drug of choice to relieve an attack? That's nitroglycerin. What does the drug nitroglycerin work to relieve the pain of an angina pectoris? So it is a vasodilator, and what that means is that it dilates the blood vessels and helps, because with angina they are restricted, so it opens them up. How much oxygen should we give to a patient who is having an angina attack? And that's 5 to 6 liters per minute. Where should you document everything that occurs during an emergency? And that's in the patient's record, and then also on the medical emergency form. If your patient has an emergency, where should you remain until the emergency situation is completely resolved? That's by them. And the number 1 thing you can do to prevent an emergency is to keep a good medical history. So that was angina. Next, we have myocardial infarction, also known as heart attack. Okay. What is atherosclerosis, and how can this disease increase a patient's chance of getting myocardial infarction? So, like I said before, atherosclerosis is when the fat builds up in the arteries and in the blood vessels, and then this can increase the patient's chance of having a heart attack because it restricts oxygen from going through, causing that myocardial infarction. Pain from angina pectoris occurs as a result of stress or exercise. When does pain from a myocardial infarction usually occur? And that is when the patient's at rest. In which emergency is the pain more severe and longer lasting, angina pectoris or the myocardial infarction? And that would be the myocardial infarction, the heart attack, obviously. Is the pain from myocardial infarction relieved by rest and nitroglycerin? No. How much aspirin should be given to a patient who is experiencing a myocardial infarction? And that is 4 tablets of, it says 81 milligrams, but I don't believe there's 81 milligram tablets, so I think it's only 80 milligrams. Anyway, in what situation is it not advisable to give a patient who is having a myocardial infarction nitroglycerin? And that's if their systolic blood pressure is lower than 100. What typically happens to a blood pressure if a patient who is having a myocardial infarction, and that is that it decreases or drops. Should 911 be called if your patient is having a myocardial infarction? Yes. What is 4 things you should send one of your classmates to for an emergency, and that's the AED, oxygen, emergency kit, emergency clipboard. What position should a patient who is having a myocardial infarction be placed, and why? And this is you should sit them upright because it's blocking the oxygen, so it's easier to breathe when you're sitting upright. Okay. What usually happens to respirations when a patient is having a myocardial infarction? So with respirations, it's usually like shortness of breath. How often should we take vitals during an emergency? And that is every 5 minutes. How much oxygen should be given to a patient who's having a heart attack? And that's 5 to 6 liters per minute. What should you do if your patient who is having a myocardial infarction goes into cardiac arrest? Begin CPR. Where should you document everything that occurs during the emergency? And that's in the patient's file or in their record, and then also in the medical emergency form. If your patient is having an emergency, where should you remain until the emergency situation is completely resolved with the patient? What is the number one thing you can do to prevent an emergency? And that is to keep a good medical history. Okay, that was myocardial infarction, heart attack. Okay, next off is cardiac arrest. So what does it mean when a patient goes into cardiac arrest? So the heart stops or the heart is not pumping enough to circulate blood throughout the body to obtain life. Okay, can angina pectoris or myocardial infarction lead to cardiac arrest? And that's yes. What must be done in order to save the life of a patient who has gone into cardiac arrest? CPR, right? What is the significance of CABD as it relates to CPR? So CABD, you're going to check pulse, you're going to check the airway, make sure the airway is open, and check the breathing. So after you check all those things, you're going to determine what to do next. And you need to do that before you start CPR to make sure that's the right action. What position should you place your patient in order to perform CPR properly? And that is, you need to lay them back. If you give your patient 2 breaths and the chest does not rise, what does this indicate? This indicates that the airway is not open, so you need to lift their head, tilt their chin up. Okay. What is the ratio of compressions to breaths when doing an adult CPR? And that's 30 compressions to 2 breaths. When should you stop administering CPR? And that is whenever you resuscitate the patient or EMS gets there and takes over. What 4 things should you send one of your classmates for during an emergency? Oxygen, AED, emergency kit, and emergency clipboard. Explain the technique for CPR beginning when you first realize that your patient has gone into cardiac arrest. You're going to call code blue. You're going to send someone for the 4 things that I already just stated. You are going to first check the patient, see if they're breathing, say, are you okay, are you okay? See if they're still breathing. You're gonna you're gonna call 911 after checking their pulse to see if they have a pulse. You're gonna call 911 or tell someone to call 911. That would be even better. And then after checking the pulse, knowing that they don't have a pulse, you're gonna begin CPR. You're gonna do 2 breaths, 30 chest compressions, making sure that it goes 2 inches in each time, and then just cycle that. And like I said, until someone gets there or an EMS gets there to take over, or until you resuscitate them. How often should we take pulse, blood pressure, respirations during an emergency? Every 5 minutes. Where should you document everything that occurs? In the patient's chart, and then also in the medical emergency form. If your patient is having an emergency, where should you remain until the emergency situation is completely resolved? And that's with them. What is the number one thing you can do to prevent an emergency? And that's keep a good medical history. Last, cerebrovascular accident. So this is a stroke. So I'm just going to say stroke instead of saying cerebrovascular accident every time. What are the 2 major causes of a stroke? And so this is not enough blood to the brain, or it can be a hemorrhage. Okay, what are five common symptoms of a stroke? It's headache, dizziness, nausea, like not having use of one side of the body, maybe drooping in one side, and then also can be, what did I say? Just nausea. Oh, and also like speech, loss of speech, can be one of them. What does the S and the T and the R in stroke represent when trying to identify if a patient has had a stroke or not? So the S is speech, or no, the S is smile. So you're gonna probably see, like I said, like a drooping face, like a drooping face, and then the T is for talking. And then R, so they're gonna have like slurred words, and then R is raising arm, right? So they should only be able to raise one arm, not the other. How does a stroke usually affect the pupils? There'll be different sizes. Should you give aspirin to a patient who's having a stroke? No. And because it could be a hemorrhage, so you don't want to thin the blood even, like to make it bleed out more. What position should you place a patient who's having a stroke? And that's upright, and that's to relieve pressure on the brain. What 4 things should you send one of your classmates for during an emergency? And that's emergency kit, emergency clipboard, oxygen, and AED. How often should we take vitals during an emergency? And that's every 5 minutes. Can we give oxygen to a patient who is having a stroke? Yes, we can, and you're going to give them 5 to 6 liters per minute. Where should you document everything that occurs during an emergency? And that is in the patient's file and in the medical emergency form. If your patient has an emergency, where should you remain until the emergency situation is completely resolved? That's by them the whole time. And then, what is the number one thing you can do to prevent an emergency? Keep a good medical history, and in your own words, step by step, tell me how you would treat a stroke emergency in our clinic. You would call code blue. You would send a classmate for the 4 things: the AED, oxygen, emergency kit, emergency clipboard. You would send them. You would sit the patient up. You would give them the oxygen and take their vitals, but probably call 911 at first sign of anything. After you call that code blue, you see the signs, you see that you call that code blue, you send your classmate for that. You're going to call 911 before you sit them up, right? So you're going to sit them up, you're going to give them oxygen, you are going to take their vitals every 5 minutes, as well as just calming them, right? Just keeping them calm until EMS gets there. And hopefully they get there soon, because fast acting is the most important thing about a stroke. But if they go into cardiac arrest, of course you would lay them on the floor and start CPR. Okay, that's all.